I briefly show you the case of a patient who was referred to our eye unit because of the onset of a white cataract, but really he had an ocular trauma when he was a child, and he had the concomitant total retinal detachment. So I was aware that I had to do probably a long-lasting surgery and with the best visualization possible for the peripheral retina. This is how the eye presented. You can see that there is a wide dialysis of the iris at 5 o'clock. And this is the video of this surgery. And first I try to fix the dialysis with an iris and capsular hook. Then I went on dyeing the anterior capsule with trypan blue. I go on faster now. And then I'm preparing to inject the maluging ring. I have a 2.0 millimeter wide corneal incision because I was going to remove the cataract with a 1.8 phaco tip. And now I am going to inject the viscoelastic in the anterior chamber. I'm going to fill completely the anterior chamber, but I'm going also to inject a small amount of viscoelastic just beneath the iris at 3 and 9 o'clock in order to raise just a little bit the iris and to favor this way the engagement of the two side scrolls. Now I'm going to engage first the proximal one, then the two side scrolls by tilting a little bit the ring to make it easier. This not really very easy maneuver in some cases. And then I release the last scroll by helping myself with an Osher manipulator. And that's it. Then capsular axis. There was an eye pressure inside the capsular bag, so it tended to escape, but I could control it. Anyway, I would like to see the removal of the cataract. It was very quick. The cataract was completely white, but it was a soft one, so it was not a big problem, a big issue. And now I'm going to show you what I meant when I was saying that I needed to have a wide dilation of the pupil, because the retinal detachment was very old and it had several epiretinal and subretinal proliferation. And during this type of maneuver, when you have to remove subretinal cords like this, it is really very, very helpful to have a pupil widely dilated, to increase your peripheral visualization of the retina. Oh, you can see how thick that this subretinal cord was. And then even while performing the peripheral vitrectomy with the scleral depression, I'll tell you one more that how important it is to have a wide dilated pupil.